So I'm going to introduce to you my dear friend and colleague, Dr. Narendra Parson. He's a board-certified anesthesiologist who's been in practice for 35 years. And we're going to talk a little bit about his experience with Goldilocks anesthesia, which of course is the brain-monitored propofol ketamine. So Dr. Parson, could you tell us a little bit about your experience?
Well, we've all used ketamine for years now. However, it fell into disrepute. We stopped using it because personally I think we were abusing it. So I met my friend Barry and he reintroduced me to ketamine. It was very interesting. He didn't push it, he didn't do anything, he just said, try it. I said, well, what's the harm? So I did. And he also explained to me that at least initially, if I wish to continue, I would use the BIS monitor because it does really give you a very good perspective as to what your patients are going through with whatever dosages or other medications you may wish to use in conjunction with ketamine. So for the last about couple of years or so, since Barry talked me into, he really discussed it nicely, and I thought it was a great concept. I didn't believe him at first, obviously, because I said, yeah, I've been doing fine, and what the hell for?
Right, that's exactly the problem. Most people's perception is they're doing fine, but the question I always pose to them, would you be interested in trying to do better?
Exactly. And that's what the whole idea of trying something to me was very appealing. So I said, fine, we would try. So I started only on healthy people, using adults, of course, about anywhere from 35 to 50 milligrams of ketamine. And the timing, I thought, over the period of time I learned, and Barry was emphasizing that from day one, the time it is before an incision, approximately 3 to 5 minutes. And I said, how can it be so? But anyway, I tried. Let me tell you, it is fabulous.
Not subtle difference.
No, it's if you monitor the BIS, you'll see the sudden dip, and it's perfect timing. So I'd say, well, it could be a fluke for the first few times that I tried. But now I use it routinely, and I do an average of maybe, maybe 4 or 5 cases a day, so about 20-25 cases a week. And consistently, I find the patients very nice, very comfortable, and nice amnesia.
Talking about how the patients are in recovery, you mean?
That's right. And so that's why and of course surgery, of course, you take care of and they're done. Our cases, just to emphasize this, are mostly musculoskeletal, pretty involved orthopedic surgery. We do knee replacements, for example. We'll do major shoulder repair.
So we're not talking cosmetic surgery here, right, Narendra?
Exactly. That's why I'm trying to separate, because I know Barry is involved mostly in cosmetic surgery. But here I found they need less narcotics. And you obviously know the advantages of using less narcotic, less anesthetics. And overall, patients go to the recovery room, and I just said a few words earlier about the recovery room. The patients feel good. They're a little drowsy, but very arousable. They'll eat, drink, and I think our stay, we do a quality assurance program where we did the study on how quickly they react to waking up after, what we did was intracrucial ligament reconstruction. And they were really awake within half an hour, drinking, eating, and we normally keep them at least an hour, 15-20 minutes, and they were ready to go.
In the first half hour?
Absolutely. They were prepared to go, but
right.
Don't let them go
sure.
for an hour and a half or so.
And what sort of feedback do you get from the recovery room nurses? Because not everybody here is doing what you're doing,
exactly.
Right?
So, well, that's interesting. So someone saw how my patients are waking up. One of my colleagues, they said, what do you do differently? So I said, well, Barry showed me about this ketamine, and I've been using this. So I'll try it. So now we have about 12 to 15 anesthesiologists circulate through my surgeries over here. We have 5 operating rooms. So a couple of them are trying and they're kind of surprised. They come and say, wow, that was interesting. And so overall, I think the acceptance has been slowest with the physician group, anesthesiologists namely, as compared to para physician or the for surgical nurses and or PACU nurses, etc. Even they now are turning around, and they actually they are the ones that love it, whereas the colleagues think can't be.
Right. They're still concerned about hallucinations, hypertension, and tachycardia, which is why you sort of shied away from the initial 50 milligram dose independent of body weight.
Exactly. And I think overall at that dosage, there is very insignificant, if any. I have not noticed any significant changes in any parameters other than the fact that they are more comfortable, they wake up smoother, they require less anesthetic. So actually I'm sold on it.
Okay, very good. Well, thank you so much. Let's take a look at this.